Good afternoon, everyone, and thanks for being with us. I'm Mike Coburn, Research America's Executive Vice President and Chief Operating Officer. Before we begin our program this afternoon, just a couple quick reminders. You can follow along on Twitter with the hashtag RAForum. And you can also view the full speaker bios by clicking on speaker names listed on the program. So our next Fireside Chat is a conversation with Dr. Nakela Cook, the Executive Director of PCORI, and Nancy Brown, the Chief Executive Officer of the American Heart Association and a Research America board member. Nancy and Nakela, thank you for being with us today. And Nancy, I'll turn it over to you.
Mike, thank you so much. It's really an honor to be here today on behalf of the Research America Board with my amazing friend, Dr. Nakela Cook. Nakela, we were so excited when you were named the new Executive Director of PCORI, and I really look forward to this discussion today, especially because yesterday we heard from several panelists about how research can be used to improve health equity. And there's no question that COVID-19 has spotlighted the disproportionate impact on the Black and Hispanic communities. And as a nation, we continue to battle COVID-19. There's renewed energy around efforts to address equity and health disparities. Having known you, Nakela, for as long as I have admired how you've worked throughout your career to enhance diversity and equity in research and in delivering care. You've also led efforts to reduce disparities for people to improve their access to health and their health outcomes. You are a practicing cardiologist and obviously a health services researcher, and now as Executive Director of PCORI. We'd love to hear your perspectives and how you're addressing health disparities through the lens of cardiovascular health.
Thank you so much, Nancy, for that warm welcome, and thank you for those who have invited me to be here today. It is just such a pleasure to have this opportunity. And as I think back about how I've focused in terms of my trajectory on thinking about health services research, health disparities, and as a cardiologist in this field, I actually was moved to address several of these issues related to health disparities because of my lived experiences. I grew up in Alabama, where I witnessed health disparities and social determinants of health even before those terms were really coined. And I grew passionate as I went on to medical school and through training to figure out how to bring all of these efforts together. And at the National Institutes of Health, where I worked prior to coming to PCORI, I was able to bring together these pieces of cardiology and health services research and eventually even policy. And now it just feels destined to be at PCORI, where I can do all of these things at a place whose mission and values really resonate with me in terms of thinking about how we bring patients to the center of our research processes and how we think about that engagement that will help us to work towards the elimination of health disparities. And I'm also proud that PCORI has a very strong record of research and engagement projects as it relates to health disparities. And in fact, addressing health disparities has been a national priority at PCORI over its last 10 years. We have funded over $300 million worth of projects, almost 100 projects in this space, all focused on the research that can help improve the disparities that we witness in health outcomes. I also think PCORI has a really critical role to play in identifying solutions to disparities in cardiovascular health and other conditions. And specifically, we know that the disparities in cardiovascular health are just critical for us to address, whether we're talking about race, ethnicity, geography, or even where people receive their care. And the focus that PCORI has on the healthcare that's delivered, the shared decision-making, and the elevation of communities as partners in research, I think has a real opportunity to shift the tide. One of the examples that maybe I'll mention from the PCORI portfolio is a program that actually works with Black men who are at high risk for cardiovascular disease and other diseases about how they can actually reduce their health risks. And the research in this program actually found that this tailored approach, called a Active and Healthy Brotherhood program, had larger decreases in high blood pressure and high blood sugar 6 months into this intervention compared to those who were receiving just typical care. And so this type of research is the kind of research that we not only want to conduct, but also build on in terms of how we move findings into implementation, dissemination, and uptake into clinical care. And that's a component of the full spectrum of work that PCORI is devoted to. And I think I'd be remiss if I didn't say one other thing about PCORI and the work in addressing health disparities, and that's the opportunity that we see now. As you mentioned, and even your opening remarks, the disproportionate mortality that we're seeing related to people of color from COVID-19, and the call to action really to illuminate the racism and pervasive effects of racism that have actually highlighted an urgency for us to address things like discrimination and bias in health and healthcare are really windows of opportunity for us to redefine our problem and redefine this problem in a way that engages patients and stakeholders to help us understand how we can really deconstruct some of the concepts that are driving health disparities and think about those interventions that are addressing this multi-component, very complex issue in order to make sustainable differences. So we're thinking about doubling down on our efforts and not just thinking about addressing disparities, but eliminating them and moving from descriptions to interventions and solutions, as well as thinking about the opportunities that we as funders can have in thinking about the way in which we recruit individuals to the research process, fund them through research solicitations, applications, and awards, and make sure we're actually implementing our research findings in a diverse participant pool. And so those are some of the things we're thinking about as it relates to health disparities.
Wow, Nakela, that's an impressive list, and there's no question that your leadership and the leadership of PCORI really helped set a national direction, and we're all very excited to hear those words, doubling down. You know, another area PCORI has made significant investments is in heart health and supporting research and community engagement, including through our jointly funded American Heart Association PCORI Decide Center, which is focused on atrial fibrillation. Tell us a little bit more about your work in cardiovascular diseases and heart health. We'd love to hear more about that.
Certainly. And as many may know, cardiovascular disease, being one of the leading causes of death in the United States, is also one of the top conditions that PCORI actually focuses its research portfolio on. It's one of our top 5 most funded conditions at PCORI. And again, a large amount of investment over the years and studying over $300 million worth of investment and over 70 million projects related to cardiovascular disease, or 70 projects related to cardiovascular disease. So it's really an area of strong funding from PCORI's perspective. And we've also been working to actively think about the opportunities for wider uptake and dissemination of our comparative effectiveness research results related to cardiovascular disease, and continue to think about this next phase of PCORI and how we can embed in our national priorities that we're establishing for the future in our research agenda, our focus on cardiovascular disease. And maybe I'll give you an example of a way in which PCORI's work and its purpose related to comparative effectiveness research plays out in this portfolio related to cardiovascular disease. And one example is that a comparative effectiveness study that looked at a decision aid and for patients that were presenting to the emergency room with chest pain. And this decision aid was actually utilized to help people in the emergency room understand their risk for heart disease, as well as their options in terms of going home and pursuing outpatient-based care versus staying in the hospital for ongoing monitoring. And the important thing is, of those participants in this study who were found not to be having a heart attack and utilized this decision aid, they were actually more likely to want to opt to an outpatient management schedule in terms of their follow-on care. And this type of work, now having gone through the rigor of a study of its sort, is the type of thing that we at PCORI take the next step on. And so we're working now to disseminate and implement these findings, and working in 3 different states, 5 different systems, in order to pursue the uptake of this decision aid in emergency room care. You also mentioned the Decide Center that AHA and PCORI work together on. And that's a great example of how PCORI partners with other funders. And in fact, we also partner with other funders such as the NIH and others in thinking about opportunities to address cardiovascular disease. We have some joint funded work going around reducing hypertension in underserved populations, as well as in high-risk populations with the NIH right now. And we really look forward to continuing to explore those areas where we want to make sure we're focused on for the future. We're about to launch that process to reestablish our national priorities for research in the coming years. And so we look forward to being able to engage with the American Heart Association, its members, as well as those members and those interested in the general public, in helping us to set those priorities for our research agenda moving forward.
Well, that's wonderful. And we all have admired the very inclusive way that PCORI sets its research agenda. And so excited to hear that that process will begin to be underway again soon. So, Nakela, I remember the day you were announced as the new executive director of PCORI. It was in April, right when the pandemic was in full swing. And one of the things we've seen during the pandemic is this shift to engagement in telehealth between healthcare providers and patients. And we'd love to hear the perspective of PCORI as it relates to new and emerging technologies to manage health. I know at the American Heart Association, we are doing a number of things with big data and registries to support the gathering of information during the pandemic and the aggregation of data to aid research and disease treatment, et cetera. What's PCORI thinking about this, and what are the patients that you're engaged with hopeful will happen?
That's a great question, Nancy. And you're absolutely correct that right at the start of my tenure at PCORI, the board and the PCORI staff shifted very quickly in order to think about the opportunities for PCORI to really make a difference in this pandemic, and recognize that we had at our disposal really the opportunity for a multi-pronged approach, which included looking at the adaptations in healthcare delivery that were just necessitated by the pandemic, as well as thinking about those on the front lines of care and the vulnerable populations that were affected disproportionately due to COVID-19. So those were kind of the three areas of primary focus where we intensified our efforts. And we also thought that comparative effectiveness research itself was going to be critical during this pandemic in order to think about the delivery models of care and comparing them in terms of outcomes for patients. So maybe some specifics would be that as we looked at the delivery of care, we were able to capitalize on the awards that were already underway under PCORI's funding, and allow for the adaptation of those awards to now take on aims that may be more specific to issues that were being addressed during the pandemic. And this has been a remarkable program where we've been able to fund over 100 different projects, many of which are focused on an adaptation from traditional face-to-face care to telehealth or telemedicine, as well as thinking about those individuals that have had chronic conditions and are now facing COVID-19 on top of their chronic conditions, and dealing with the questions that emerge in that setting, whether it be related to the complexities of hypertension, obesity, and diabetes that we know actually compound the outcomes related to COVID-19. We also had the opportunity to invest in some new studies and put a targeted announcement out for rapid funding of research related to COVID-19. And through this, we were able to focus on some vulnerable populations, those such as individuals in nursing homes and frontline workers in nursing homes, where we know individuals are putting their health on the line every day to take care of others. We also were able to focus on telemedicine and how telemedicine may either reduce or exacerbate disparities in the setting of COVID-19. And so we have a project focused on that. We also have a project that was focused on thinking about the mitigation strategies and containment strategies that were executed across the country, and how that actually impacts vulnerable populations and populations that are more underserved. And lastly, I may give you an example of an enhancement related to heart failure, where we had an adaptation of one of our projects where a team actually is now trying to study whether telemedicine may have longer term implications for management of patients with heart failure, taking advantage of this window to look at it during COVID-19 to extrapolate into post-COVID-19 reality and care. I'm very excited too that we were able to pull together in pretty short order a registry of healthcare workers, that third domain of important to priorities for PCORI's response to COVID-19. And that registry is providing us information from the front lines in terms of how our healthcare workers are faring, what kinds of issues they're dealing with, as well as the types of things that they're interested in terms of research opportunities to participate in trials and other activities to address the pandemic.
The HERO registry, which I know is your registry of healthcare workers, is really incredible. And as an organization at the AHA that focuses a lot on registries for cardiovascular health, we really admired the participant focus on the HERO registry. It's similar to what we've done at AHA with Research Goes Red, where it's very participant focused. And so we'll all learn a lot from our healthcare workers, the real heroes of the pandemic. You know, Nakela, you have a wonderful opportunity in front of you, even with the fact that we're in the middle of a pandemic, to think about a vision for PCORI moving forward. And I think everyone here would love to hear from you. What is your vision, and what are your dreams and aspirations for PCORI in the future?
Well, you know, we've been calling our next phase of PCORI 2.0. For reasons that it builds on so many achievements of the first decade. And in many ways, we couldn't be where we are today without those achievements of really developing an infrastructure that was robust enough to solicit and fund the type of research that was really specific to PCORI. But also in that first decade, I think one of the amazing achievements was the process around engaging patients, from topic solicitation and kind of understanding of topic refinement through the research process, all the way through dissemination and implementation and promotion of results and findings. And so I think that's just something to be lauded and applauded. And we look forward to the next phase for PCORI, really capitalizing on some of those pillars of engagement and innovation and thinking about how we do research differently. We also see in the future of PCORI an opportunity to advance learning, patient-centered learning healthcare in a way that really integrates research and clinical care to try to advance more rapid cycles of evidence to implementation and accelerate results to patients. And in this type of model, we envision a PCORI that is asking questions that are relevant to patients and leveraging even the data and technology that resides in healthcare systems and in other settings for clinical comparative effectiveness research and even implementation science that can help inform context-specific dissemination and implementation efforts, really reducing that time from evidence generation to actually uptake of results. We also envision in our future of PCORI continue working with so many of our partners and stakeholders and really the broad array of the healthcare community to try to help develop our next decade's action plan, so to speak, for research funding, for our research engagement, as well as the implementation of our research results. And we anticipate building a culture as well of diversity and inclusion, doubling down on things like I mentioned in terms of health disparities, and building a robust community of an applicant pool for comparative effectiveness research type activities so that we can really approach the ability to improve the healthcare delivery and outcomes for everyone. As part of some of these next steps, I mentioned that we're about to renew this process of establishing our national priorities and our research agenda. And what we really are looking forward to doing is garnering the input from all of our stakeholders and the public, as well as our advisory panels and others, in order to distill down those areas that are going to be of prime focus going forward. but we've already heard some things. We've heard about the strategic imperative to really embed what we're proposing to do related to health equity throughout everything that we do, and just interweave it throughout all of the activities at PCORI, and to be bolder in that space. We're also starting to hear more about making sure that we continue efforts to support underrepresented communities, and thinking about that entire research enterprise, and how from earliest days of engagement of patients and communities as partners all the way through the research continuum, that we are thinking about the underrepresented communities, conditions, et cetera, in that process. And so we're continuing to think there. We also had several things for our next decade that were embedded in our reauthorization language. And we recognize the importance of focusing on those efforts in a very multi-pronged long-term way. And one of those is maternal mortality. And it intersects in so many ways in dealing with the issues of healthcare and health disparities, and particularly the fact that we know women of color, particularly Black Americans, Native Americans, and Alaskan Native women, have rates of 2 to 3 times higher in maternal deaths as compared to whites. And so it's incredibly important that we continue to push on that agenda as well. So those are some of the things that are to come in PCORI 2.0, but we're excited to map that out with all of you.
Yeah, what an exciting agenda for sure. Yesterday, the American Heart Association hosts many scientific meetings, and we had our hypertension meeting, which is ongoing right now. And you may or may not have seen a study that was released looking at NHANES data that showed that levels of controlled blood pressure has gotten worse by 11% in a 3-year time period, especially for those disproportionately impacted by lack of access to health care. There was a really startling statistic that for people who had not seen a healthcare provider in the last year, they had an 8% control rate of their blood pressure. And, as a cardiologist and as a leader of an organization that's thinking about health disparities, this is, a great moment, I think, for us all to speak up and demand something different for those individuals who aren't able to have access to what they need to live the same kind of life that the rest of us do. When you hear a study like that, what goes through your mind as a cardiologist and as a leader of PCORI?
Maybe the first thing is we've come so far, yet we still have so far to go. And I think that's one of the challenges in talking about issues like this, and issues related to health disparities, underserved populations, is that we recognize we've been focused on these issues for a long time. It's been 17 years since the Institute of Medicine landmark report, Unequal Treatment, was published, that really framed the issue of health and healthcare disparities, but yet we still have these kind of conversations today. So I guess one of the things that goes through my mind is, how do we move to sustainable change, and the type of change that really has a substantial impact on the populations that are most affected? And that's just one example, but there are probably several that we could articulate related to these same types of challenges. And maybe that's the place where I am excited to be at a place like PCORI that allows us to really think about how we do things differently. So what is it that we can learn from those individuals and those patients that are the percentage that are not well under control right now, to try to understand what challenges they face and think about different types of solutions. Because we can sit in our offices or chat with our colleagues about what we think would work, but until we actually talk to those that are affected and engage them in that process of trying to figure out what works best for them, I think we're going to miss the boat every time. So maybe that's one of the things that encourages me about what we have as opportunities moving forward, because we are now recognizing these things. We're now engaging our patients and their communities in research, and we're going to learn so much more about what it takes for the next decade or the next trend study to look quite different.
Yeah, such great points. Nakela, the last question I have for you before we open it up for any audience questions, you have this amazing group of people viewing in right now. As the new executive director of PCORI, how can we help you? And what is it you would like to hear from people in the organizations that are represented on this call today?
You know, one of the amazing ways I think that all of these great organizations can help us is exactly in some of the things I mentioned around hearing the priorities. So we're very interested in hearing from all of you and from the American Heart Association and other organizations, some of the things that your members and your communities are talking about in terms of the priorities of focus moving forward. And so we want to be that organization that is focused in a public serving way, and that we're thinking about the issues that are external to us that are really important for the health of the nation. So I think it would be critical to hear from you as we start to move into setting our national priorities and research agenda. And furthermore, I think the other opportunity in terms of helping us advance is this is a collaboration, partnership, collective action in order to deal with some of the issues that we've been talking about, especially as it relates to health disparities, as it relates to cardiovascular health. Not one single organization, I think, that may be tuning in can do this alone. And so I think our strength is in partnerships, collaborations, and the thought leadership that perhaps we can bring to ideas, ideation, and solutioning together that I hope that we can continue.
Wonderful. Thank you so much, Nakela. So I think we have some questions from the audience, and let's see if we can get those teed up for us.
Thank you so much to both of you, and I appreciate the conversation that we've had today. Nakela, you've brought up some very good points on engaging different populations. We have one question here that PCORI has placed a strong emphasis on engaging racial and ethnic minorities in clinical research. Yesterday, Dr. Fauci mentioned that they are working hard but need to do more to increase racial and ethnic minority representation, especially in COVID-19 vaccine clinical trials. Are there lessons from PCORI's efforts that would be helpful as recruitment in COVID-19 vaccine and treatment trials continue?
That's a fabulous question, and one that we're actually hearing quite a bit at PCORI, because one of the things that we found in our efforts related to the last decade of engaging patients and communities in research is that we actually can leverage that towards increasing the diversity of participants in research. And so one of the things that I think is critically important is not only that engagement be part of dealing with the trials and tribulations of the COVID-19 research environment, but also in terms of thinking about how if engaging early actually can help us move towards the diversification of participants. One example I'll give relates to kind of the concept of gatekeepers in communities. And so having certain individuals that really understand the community, institutions that really understand the community, be involved in how we think about the research process and enterprise is actually one of the ways that we enhance the participation of the individuals in that community in the research process. And so I guess my one piece of advice from what we've learned at PCORI is engage throughout and engage early, but also remember it's never too late to engage. And so, you know, we have been talking with some organizations that have already started their thinking about how they want to move forward certain activities related to their COVID-19 research. But our message has been it's not too late, because we know that even engaging with patients and communities wherever you are in the research process will enhance that participation of the diverse communities you're trying to reach.
Great, thank you. Our next question here, recent research indicates that COVID-19 may damage the heart muscle cells, leaving patients vulnerable for future heart failure. Is PCORI doing any research currently in this area, or supporting any research in this area?
It's a great question. Probably the closest things that we've started to support in this space has been amongst an award that was already focused on heart failure research, and is looking at some of the intersections related to COVID-19 and heart failure, and tracking what's happening with those patients and participants in that project. We have done a little less in terms of thinking about the mechanistic process that may be at play, given we tend to focus a lot more on the comparative effectiveness research that comes a little bit later in the research continuum. However, we are still at a point where we recognize COVID-19 will be with us for a while and are starting to think about that next wave of activities that PCORI needs to focus on related to COVID-19 research. And one of the things I think is critically important is the long-term complications that we anticipate seeing from this illness, and understanding some of those complications and the long-term impact. We have started in our PCORI, or Patient-Centered Outcomes Research Network program, pulling together information in terms of those individuals that have been affected by COVID-19, and we'll have an opportunity to be able to, the investigators in that PCORI team will have an opportunity to really delve into understanding some things like longer term complications. And so this may be an important intersection as we move into our next phase of COVID-19 research.
Great. Nancy, I think we have time for just one more question before I turn it back to you. Dr. Cook, you mentioned your hope and excitement for engaging patients and that you're really looking forward to your new endeavor. What's the biggest hurdle to ensuring patients play a role in the research process? Or maybe it's multiple. What is that for you?
Yes, there are actually, I think, several hurdles, and that we've been learning and thinking about how to overcome that. But one of the things I have learned from my colleagues at PCORI is that our research community is not averse to the engagement of patients and others in the research process, but do look to us for some help in terms of how to enable that and how to do it. And so it may not be the natural way in which research is thought about when you go through a kind of research training program or other activities. This isn't necessarily the way that individuals are taught in terms of thinking about their investigator pathway and their research pathway. So they really look to PCORI to help navigate that, or even to show examples or to point to groups that are actually working in certain spaces in order to make the connections that are difficult. So I'd say that's actually one of the challenges, is just providing that facilitatory support to have that meaningful engagement in the research projects, but not that there's there is a will, so to speak, to do so. It's just figuring out how. The other piece that I'd say is probably a challenge in this is that it does mean that the research pace looks differently too, different as well. And so there definitely is an opportunity to listen and to incorporate that will change the pace of how research may have been thought about or done before. And I will recall a recent story someone told me about an investigator who used to go spend time sitting at the church and basically sipping coffee after church service in order to be able to engage the community that was really part of the project that he was trying to study. And this was an underserved community that he was very passionate about, but he had to sit and listen, and he had to build trust, and he had to figure out how to engage in the appropriate path. And that takes time. And so I'd say that's one of the other hurdles we see, as making sure we have that patience for the time to sit and listen and incorporate what we hear.
Thank you. Nancy, back to you.
Great. Thank you so much. And Dr. Nakela Cook, thank you for this time today. We are all inspired by your vision for PCORI 2.0. I know that you and your entire team at PCORI will help address these health issues, especially the health disparity issues in this country, head on. We are here to support you and to work with you and your wonderful team. Congratulations again on your appointment, and thank you for making time to be with us today.
Thank you so much.
And our thanks as well, Dr. Cook. And Nancy, thank you so much for the terrific conversation with Dr. Cook. We appreciate it. I just want to say PCORI and the American Heart Association, as well as all the sponsors and many of the speakers you heard from today, are members of the Research America Alliance, and we thank them for their membership. If you're not a member, we'd love to connect, so please visit the Research America booth in the exhibit hall. As we prepare for young scientists to engage with us on Flash Talk competition, it is fitting that the next 3 23-1 videos feature leaders who do a terrific job providing compelling, pithy answers to research-relevant questions.
We first need to consider what lessons COVID-19 taught us. We've learned a few things. First, we have gaps in public health magnified by problems with health equity and access. Second, for such challenges, we need strong leadership that coordinates responses and collects timely, actionable data. And third, much of what we do in health might be done virtually. So consider some background here. 2 months before the pandemic began, a major study was published measuring pandemic preparedness across 195 countries. The US was predicted to rank first in pandemic preparedness. But when the pandemic hit, we did really poorly. So why? In that study of multiple parameters, the US ranked high in areas like labs, epidemiology, response time. But in a small subset, the US ranked poorly, including socioeconomic resilience, access to healthcare, communications infrastructure, and political risk. The lesson: if our healthcare system does not function as a system, if there are substantial health disparities, and if, when tested, it lacks central political leadership, then the effectiveness of those other assets is undercut. Attention to healthcare access during the pandemic was also magnified as 27 million Americans lost their employer-sponsored health insurance. Also, we can contrast the US response with that of other federated countries like Germany to see that since viruses don't respect state borders, early and strong federal leadership is required to develop testing, contact tracing, protective equipment availability, and critically collect high-quality, real-time, actionable data. Lastly, a major learning came in telemedicine. The level of adoption, which might have taken 10 years, occurred in about 10 weeks. Many physician practices went from exclusively face-to-face to exclusively virtual overnight. So will these learnings of the need to address access, disparities, federal responses, and virtual integration, will these result in changes in the nation longer term? I don't know. I think so in the area of virtual approaches. I also think the currents flow in a supportive direction to address access and disparities. Political leadership, I think that remains a wild card.
What is your greatest hope for the future of science? First, I'd like to thank you, Mary Woolley, for your leadership and for bringing the Research America community together today, and for asking the question, what is your greatest hope for the future of science? The future of science is something we get a glimpse of every day at the Rita Allen Foundation, for we're investing in early stage scientists who have pioneering ideas to explore. They have a long view into the future with their research, and of course, they don't know exactly what they will discover, nor when they might discover something that would be transformative. And yet, we've seen over 4 decades that their collective impact is extraordinary. Through the years, they've made great advances in the areas of cancer, chronic pain, neurological disorders, immunology, and even CRISPR. Their research has earned wide recognition, including a Nobel Prize. For us and for so many others, science is hope, and investing in early stage scientists is essential to our future. And yet, there have been many changes in the research environment, as we can see with the pandemic and other crises. And so, to build on the remarkable, accelerating progress of science, to allow science to respond to society's critical needs, will require a new kind of leadership support and new approaches to more broadly and intentionally build civic relationships and to engage communities so they can participate in and benefit from and support science, so we can be good stewards of the future together. And as we gather here today to build this work, we know that there's an urgent imperative to equip diverse new generations of leaders to help deliver our hopes for the future of science. We also know that we have a lot of work to do to heed the call that I hear loud and clear from our community and beyond, that science, like many other institutions in our society, become much more inclusive than it has been historically, and that the diversity of its participants and leaders represent the diversity of our nation, and that every young person can see themselves when they look at scientists, civic scientists, science-strong leaders, and that they're not only encouraged to participate in science, but that science understands and values their participation, and that this is vital to our future and to the future of science. And that science recognizes it's not apart from society, but integrated into it and responsible to it. Mary Woolley and Research America are calling us together with a vision of creating science-strong leaders and communities. And to achieve this vision, they're offering some incentives so that young scientists who are very interested in becoming civically involved in their communities can build those new relationships and teams that we so urgently need. They're also helping to launch a new Civic Science Fellows program along with Rita Allen and other partners for stronger and more inclusive connections between science and society. And we all, of course, all realize that we're not going to do it alone, that there's, again, much to do. And as scientists see the merits of working collaboratively across disciplines, so we're also going to need teams that perhaps aren't used to working with each other in order to figure out how to create even greater public benefit, especially working with communities that have been overlooked, marginalized, and not included. Supporting young, diverse leaders who want to create science and these relationships offer all of us a more hopeful future for science and society. And that, from my perspective, will help science continue to give us our great hope.
Patient advocacy organizations accelerate scientific progress by building a movement, fostering collaboration, and expanding resources. The National MS Society vision is a world free of MS. And to people with multiple sclerosis, it doesn't matter where in the world a cure is found. Finding a cure is what's important, and that takes research. The National MS Society is the largest private funder of MS research in the world. Virtually all the MS breakthroughs to date have been achieved in part because of MS Society investments. In addition to funding grants, we support the careers of scientists through fellowships. The Society has helped launch the careers of more than 1,000 MS researchers and has provided early career support and funding to nearly every recognized MS researcher making breakthroughs today. So supporting careers and funding grants helps build a worldwide network of MS researchers, adding to the MS movement. People with MS, the foundation of the MS movement, are empowered to create change. Our nationwide network of 35,000 MS activists communicate year-round with their legislators, reminding them of the importance of research funding by providing stories about the impact of research on their lives. People in the movement impact government research spending. A strong internal research staff is critical to effectively awarding and managing research portfolios. These staff are also important influencers in research funding beyond the MS Society budget. They coordinate with government research funding and co-fund appropriate projects to accelerate progress toward MS solutions. In addition, nonprofit health organizations have a unique opportunity to increase collaboration among academic and industry researchers by defining the needs, bringing scientists from various disciplines together, engaging people with MS. We can overcome obstacles in collaboration and help focus the whole continuum of research on finding cures. Accomplishing our vision of a world free of MS requires relentless focus and determination. It requires a coordinated movement. Nonprofit health organizations build movements. The strength and influence of organizations can be measured by the size of the movements they create. When an organization with a significant movement provides leadership and research, they bring people affected by the disease to the research table. They increase public support for science and research funding. They convene all stakeholders to break down the barriers of collaboration, and they ensure focus on research that leads to life-changing breakthroughs and cures. Patient advocacy organizations can inspire collaboration to accelerate scientific progress toward cures.
I think you'll agree with me that our 23-1 series is really inspiring. We thank the participants who shared a little bit of time with us to inform and inspire. So right now we're going to take a very short break until 2 p.m. And then I tell you this, is you won't want to miss it. It's our Flash Talks competition featuring young scientists from industry and academia who will, in just 3 minutes, educate each of us about their research. We've assembled a panel of top-notch judges, and this will be fun and not to be missed. So join us 2 p.m. in the auditorium. So let's adjourn for just a few minutes and see you in a couple minutes in the auditorium.